So one of the main pathologies that we treat in the hip is a labrum tear. A labrum tear often goes along with a disorder called FAI, or femoral acetabular impingement. And sometimes what can happen is the way that the hip bone is just naturally shaped leads itself to your hip impinging on the labrum or pinching the labrum until it tears. So one of the challenges that we have with labrum tears is there's a certain segment of the population that has labrum tears with no symptoms. And so one of our challenges is to assess which of those patients really need surgery versus which can get better non-operatively. But one of the things we can do in a hip arthroscopy is we can trim down the bone on either the socket or the ball side in order to minimize the impinging or pinching on the labrum, as well as fix the labrum and thereby preserve the hip joint. So oftentimes hip arthroscopy is called hip preservation, and the idea is that if you eliminate the pinching of the labrum, either by too much bone on the femoral side or too much bone on the socket or acetabulum side, that you minimize that damage to the cartilage over time and thereby preserve the hip joint. When you have a hip labrum tear, oftentimes I think patients visualize the labrum being torn in half, which is not typically the way that it happens. Typically, the labrum peels off of the bone, leaving kind of a flap of labrum. So one of the things that we do is we trim down a little bit of the bone to create a healing and bleeding surface for the labrum to heal to, and then we put little anchors into the bone and wrap it around the labrum to bring it back to the edge of the bone. The labrum is an important stability structure in the hip, and oftentimes when we go to pull traction in the hip, we're able to easily, before the surgery, pull traction because there isn't that kind of suction seal that the labrum provides. And then after we fix the labrum, we notice that it's much more difficult. We test the suction seal, and it's actually much more difficult after the labrum is repaired, even instantly at time 0, to pull that hip back out of socket. And then we close the capsule, hopefully very quickly, because we have another case to get to. And Carolyn is like, I've got to get home by 6:30.